Hello and welcome to At the Heart of Health with Dr. James Marcum. In today's well-marketed world, it's hard to know who or even what to believe when it comes to health care. In each program, Dr. Marcum, a board-certified behavioral cardiologist, takes a balanced approach using common sense modern medicine and the ultimate source of truth, the Bible, recognizing that at the heart of health is love.
Today we have a very special guest on At the Heart of Health, and that's Dr. Terry Melvin. Sometimes we don't talk much about how the aging process and how healing occurs, sometimes often in elder years. Dr. Melvin's an expert at this, and we're glad she's going to join us today. Dr. Melvin, thank you for being here. Tell us, how did you get interested in taking care and healing of the elderly?
I did my internship and residency in internal medicine, and I did a fellowship in geriatrics. And
now, for our audience, what is geriatrics?
Geriatrics is care of the elderly.
So it's a subspecialty.
It's a subspecialty. And shortly after I moved to Chattanooga 19 years ago, going on 20, that whole topic of geriatrics, nobody even knew of it. They had only a few fellowship programs in the country. Part of my geriatrics program, or the fellowship, was doing a small component of hospice care. And when I moved here, I received a call that from Hospice of Chattanooga that they heard that I had some geriatric experience and hospice experience, and if I would be interested in working part-time. And so part-time rolled out to be a full-time life mission.
Wow.
Yeah.
Well, one of the things we really want to emphasize today is that taking care of the elderly in hospice is very much treatment as well as healing.
It is.
And a lot of people don't think of it that way. A lot of people think of, as you come to the end of your time here on earth, that it's sort of there's not much to be done. But I think that's the wrong, and we want to change that perception today.
The care at the end of life is as intense as birth, or the attention to details need to be paid, as if someone's in the ICU.
Wow.
It's not one system, it's the whole system. And it's really having a good working knowledge of what is interfering or having complications with another system.
And you're not only treating, the patient, but you're also treating the family as well.
It's the patient's illness, but it's our disease.
Right.
And a lot of times the disease component is not as much of an issue as how the disease has impacted the family and the family unit, and some unresolved issues that may have been lurking underneath the bed in that box, that will have to come out.
So you're healing on many different levels to many different members of the family.
Right.
Well, what we've done is we've collected questions and we've grouped them together on hospice, and we've actually collected them at Heartwise Ministries from all over the country and world now. And if you might have a question on hospice or hospice care, we'd invite you to go to our website at heartwiseministries.org, or you can write us at P.O. Box 8, that's Heartwise Ministries, P.O. Box 8, Ottawa, Tennessee 37363. Our first question that we're going to throw at you, and we're not saying we have all the answers, but the first cut comes from Ben in Delaware. And says, my father is 94, has terminal cancer. He has very poor quality of life. And his question is he wants to know what hospice is and what type of care my hospice has over other services. And their main goal is just having a good quality of life. So tell us, what is, you know, I guess we can talk about Hospice of Chattanooga. What is Hospice of Chattanooga? What's it all about? And how does it offer advantages over other cares at the end of life in a terminal disease when they just want to focus on quality of life?
Okay. I'm going to first start off by talking about the difference between home health and hospice. Home health is geared towards a patient getting better.
Okay.
And so there are so many days that is allowed per year per patient. Hospice is geared towards the comfort and the goal, achieving the goals as set by the patient and family. Our patients don't necessarily get better, and we are able to provide care from the beginning through to the end with different disciplines coming in: nurses, home health aides, social workers, physicians, chaplains. We follow the family for 13 years. Oh,
13
sorry.
years?
Months.
Oh, 13 months.
13
okay.
months after the death of their loved ones.
That's still a long time.
It's long and it's not. Going through the care and being a caregiver after the death, a lot of caregivers are very tired. Before they can even start the grieving, that bereavement process, they really have to rest. And so sometimes we don't see that work being done until the 9th or 10th month. So we have ongoing closed and open support groups for adults, for women who've lost their husband, for men who've lost their wives, and then children.
So one of the advantages here says just support.
It would be support. It would be changing the medicines as needed to keep his father comfortable.
Okay.
He wouldn't necessarily have to run to the emergency room. We could bring the emergency room to him.
Wow.
IV fluids, antibiotics. If we needed to do an x-ray, we do x-rays in the home. If they had gotten to the point where we just didn't want any of that, we just want him to be comfortable, we can go as high-tech or as low-tech as possible. It depends on the goal between the patient, the family, and what is it that they want. An elderly gentleman, if he had an infection, he may want a little antibiotics. He may not want a whole lot done to him.
Right.
You know, just keep me comfortable so that he can spend his time in his home, in his bed, around his stuff.
Right.
So that he can begin to start saying his goodbyes to his family.
You know, I see that a lot until caring for cardiac patients. You know, at the end of life, they're in and out. The last 6 months, they probably spend 4 of those months in the hospital. We really don't fix anything.
Right.
And they get all these IVs, and it's sort of, you know, and the family actually forgets the life that they lived.
Right.
They forget the way they really were because they're so consumed with all the medical jargon.
Right.
That's great. Let me move to another question. This is from a Tennessean here. He says, I'm concerned about pain, and how do you know if a terminally ill patient is getting enough pain medication, especially if they are not communicating well?
He's worried about pain for the care.
It sounds like making sure we have adequate pain control.
Pain control.
How do we know we're getting that?
Yeah. For people that are verbal, we ask. Not everyone want to have no pain. Some people want to still be in control, and so they're the boss. We're just sort of backseat drivers with an opinion. If they're not verbal, we can look at their face, we can look at how they're holding their body to tell us if they have some degree of discomfort. I had a little lady in the nursing home, and she would just yell, just make this kind of chanting sound, and would be in a fetal position. She had end-stage dementia. We gave her just a little smidgen of medicine and titrated it, and it got to the point where she stopped holding her arms in the contraction. She would relax, and then she didn't yell.
Wow.
You know, just like a baby's cry can tell us if they're hurting or if they need something, we can look at the patients, look at their face, look at their blood pressure, their heart rate, to tell us their level of discomfort. We rely a lot on the family because the family members know.
Because it seems like pain control is so essential. You know, no one wants to be in pain because
Right.
quality of life is zero if you're in constant pain.
Pain is interesting because we have the physical and we have what I call the soul pain. And sometimes the soul pain is the worst. And it's getting to know who this person was, how they define their life, so we could get some feel in terms of how much of this is physical and how much of this is here.
Wow.
Okay.
You know, that is so important in the healing process. We're going to take a short break, but I hope you're finding this interesting today. We're talking about hospice care, answering your questions with Dr. Terry Melvin, and she is director of the Hospice of Chattanooga. We'll be right back after this short break and answer more of your questions on At the Heart of Health.